Thanks, Kate. I just noticed on the front slide you're called Cater Wilcox. So
Cater,
no,
not
Kate.
that.
Slide. It's actually Kate, not Cater. Let's see, Stephanie, will you give us the next slide? We'll do just a little bit of housekeeping as we get started. I wanted to let y'all know that everyone is in mute mode at this point, but you're free to use the chat box at any point along the way if you have questions or comments, and we will be using that as we go along with polls and questions. So if you have any technical difficulties, please let us know or call the number that's on the screen. So first off, we want to launch just a quick poll to find out who's with us today. If Stephanie's going to launch it now, we want to know what type of agency you're representing. Local public health or tribal Title V grantee, nonprofit community-based agency, state agency, none, you're on your own, or other. Thanks. It looks like we got about 80% of the folks that are on the call have voted, and we have something under half are from local public health, about 20% from nonprofits or community-based agencies, and about 30% from state agencies. So that's a great spread. Thanks very much to all of you for joining us today. We're going to close that poll and move on. So what I'm going to do, I can't even remember if I told you with that transition. This is Nurit Fischler. I'm the Title V coordinator here at the State Public Health Division MCH section. And I'm going to give you just a little bit of framing for those of you who aren't super familiar with the block grant. Frame a little bit of what the MCH Title V block grant is and what our needs assessment is and how we're going to go about it. And then we're going to transition for some more in-depth looking at a few different topics that we want your input on. And you'll hear from three of our research leads on the project, Wes Rivers and Maria Ness and Allison Martin. Sorry, I had to look around the room in order to do that. So let me just start with what the Title V Block Grant is. This is federal funding that comes to every state, and the function is to improve the maternal and child health within the state. There's some really big bucket requirements that go with the block grant. One is to conduct the 5-year needs assessment. A second is to choose among a set of 15 national priority areas and performance measures, and develop some state-specific priorities for the maternal, child, and adolescent health population. Then we develop some strategies and measures to make sure we're really moving the needle, particularly on those national priorities, along with other states. And we make sure that we're aligning the use of the funds that we get with those priorities and strategies. So the way we use the funding in Oregon is very big picture. About a third of that money that comes into the state goes to the Oregon Center for Children and Youth with Special Health Needs at OHSU to address the needs of children with special health care needs. Another third, more or less, stays at the Oregon Health Authority here in the Public Health Division for state-level Title V work, and that's where you see a lot of the research work. That's where you see a lot of the work that your leads do on the different priorities that have been selected. And then another third goes out into the field to local health authorities and tribes, and that funding comes through a funding formula. It's determined in April of every year, and then the money begins in July. And the way that funding is used basically is governed by Program Element 42 and the Title V implementation guideline for those of you who work as Title V grantees. So right now, in this 2016 to 2020 window that we're operating in right now, we're operating with the priorities that were set in our 2015 needs assessment. And for the national priorities, those are the following: well woman care, breastfeeding, children's physical activity, adolescent well visit, medical home for children and youth with special health care needs, transition into adult health care for children and youth with special health care needs, oral health, and that's both for pregnant women and children, and smoking, again, for pregnant women and effects on children. Then we have 3 state-specific priority areas that are trauma, ACEs, and resilience, food insecurity, and culturally and linguistically responsive MCH services. So if you want to get a little bit of a picture of how that looks around the state, we made this lovely map that you can download and look at more later. It's a little hard to delve into in the big picture, but it gives you a sense of which counties and tribes have selected to work on which priorities around the state. And if you want to have a little bit of a sense of what that work might look like, it spans a lot of different strategies. There's up to six for each priority, but it might look like in communities working on trauma, ACEs, and resilience. There's folks working on workforce development, training for trauma-informed care, ACEs community awareness events, that kind of thing. There's communities working on food insecurity that are working on systems for screening and referring for food insecurity. There's a lot of different strategies going on around the state within each of these priorities. And we can give you more information on those as well if you'd like. All right, next slide. So now I'm going to transition and tell you a little bit about what this needs assessment overall structure looks like, how we put it together before we get into really talking about some of the different components and getting your input on them. So the overall purpose of the needs assessment is really threefold as far as we see it. It's to better understand the health status needs of the maternal, child, and adolescent health population around the state. And it's to engage stakeholders and partners and communities in discussions about Title V's work and how it aligns with the work of other partners, and what the priorities and opportunities are around the state for Title V to connect. So it's really an opportunity once every 5 years where we really delve into those conversations. And then third, it really does guide the selection of priorities for our state Title V program over the next 5 years. And that's what Kate was referring to in the beginning, why this is really an important and exciting time for us as we kind of check in on the priorities we set a few years ago and make sure we're pointing the needle in the direction that makes sense for the state moving forward. That timeline on the bottom is just to anchor you, go back to that one for just a sec, in where we are in this process. It does take us about 18 months to do this. We started in November with the initial planning. We're here in February getting stakeholder input, bringing forward the overall plan. And then after this, we'll really hone in on that implementation of data collection, doing the analyses, and that'll take us all the way through the summer, really. Early fall, we'll start to synthesize those results, and by late December and into January, we're going to be ready to take that information and use it really to prioritize with our stakeholders and partners what the Title V priorities will be. Then that will get folded into the block grant with strategies and measures and written up by next July. So that's where we are. By July 2020, we put this plan in place in our block grant. So the way we see it being structured, there's really 4 big needs assessment questions that we're going to be looking at. We're looking at what are the characteristics and needs of Oregon's maternal child adolescent health population, and we're looking at those in relation to both those 15 national priorities and other state needs, either the ones we previously identified, where do we stand on those, or emerging needs that have come up in the last 5 years. Then we look really at disparities in health status and needs. We look at cross-systems issues. What is it that's influencing Title V's work in Oregon that we really need to understand? And then finally, where the opportunities are for alignment. And this little visual just gives you a picture of where we see, how we see that work flowing together and what the different components are. So if you look over on the left, you see that we're looking at the maternal child and adolescent health needs. We're going to start by, on the top left circle there, looking at community assessments that have gone on in the last several years in the state. What have communities already told us about the health of this population? We're going to dig into health status data to see what that tells us. And then we're going to do a focused look that we call community voices. And that's where we look at communities and groups that have experienced disparities and ones that really haven't been well represented or heard from in previous needs assessments. So that part will be some focused qualitative work. And then at the bottom there, we'll also do some work to find out from MCAH providers and partners what they see as the needs with the populations that they serve. Then that middle box shows you that we'll next do some looking at system needs. We'll again look from the point of view of providers and partners and community voices. Really, what are the strengths and weaknesses? What's the landscape look like in terms of the emerging MCH system in Oregon? What do we need to be paying attention to? And we put all that information together then and use that in the prioritization and planning process over to the right. And we move into, we synthesize all of that and we start to look at it from the point of view of the different domains and priorities that the feds ask us to look at. And we move it into that very specific piece of work with block grant, priority selection, and develop strategies and measures. So that's our visual for how that work plays out over the next year and a little bit. When we get to that point of priority selection, this is a picture for you. This table shows where those selections will have to be made in regard to the national priorities. So what I mentioned to you before, you can see those 15 national priority areas are down on the left. And then the feds put those into 5 different domains for us. And so we will choose at least one of these priorities in each of these domains. So when we look at women's and maternal health, we'll choose either to work on well woman care, low risk cesarean deliveries, oral health for pregnant women, or smoking among pregnant women. And going across the columns, you can see what we're being given in our guidance from our federal partners about the choices. In addition to those national priority areas, we'll be looking at our state-specific priorities and identifying areas that are specific to Oregon that we'll be working on as well. So just quickly, what's different from last time for those of you who have been with us for one or more rounds of the Title V needs assessment? You know that last 5 years ago we said this is really different because you'll have to be developing plans and priorities that are tied very specifically, tying your local funding and spending to the priorities that are selected. So it's really important to be a part of the needs assessment. That remains true. It's really important because it guides what will be worked on at both the state and the local level. That's not different. But what is different really is that that chart that I just showed you looks a little different. There's changes in the options and guidelines from the federal government. So our choices will be a little bit different, or our options, not necessarily the choices we make. Our options will be a little bit different when we look at that chart next winter. There's also, it's a little different in that we're really doing an enhanced focus on collaboration between maternal and child health, adolescent health, and OCEAN with the children and youth with special health care needs piece. So you'll see a lot of that through the process. We're doing a more focused and intentional work with the voice of diverse communities, and we'll talk more about that in a few minutes. And also, for those of you who were with us last round, we had a full year from the time we chose our priorities to where we had to tell our federal partners what strategies we were doing. And this time there's a very short timeline for that. Those will all have to go into that first year grant. So that's a really different picture for us in that to the extent that we change priorities this time, we'll have to develop strategies on a quicker timeline. All right, so now we're going to switch over from this big picture view, and I'm going to turn it over to Wes Rivers, who's going to talk a little bit about the existing data sources that we're going to be looking at and get your input on those.
Yeah, hi, this is Wes Rivers. I'm the Title V lead on adolescent health. Today I want to talk about the existing data sources that we will be using for the Title V needs assessment and offer you an opportunity to connect with us with other sources of information that we might be able to use in conjunction with our qualitative and quantitative data collection. Like with other parts of the assessment, we're not going to be able to look at every piece of data or every data source that exists out there nationally or in the state. However, we're going to try to select the most reliable tools to give us the best sense of assets, barriers, and outcomes of each population. Our goal here is really, with the existing data, is to try to alleviate some of the burden of recollecting information in other parts of the assessment, and to really honor the community, the voice of community members that have already contributed to assessments in the past. So as you see, there's two big buckets of where we're collecting information. Existing information. One is on health and social determinants of health data. That comes from existing publicly available surveys and administrative data, but that gives us a greater understanding of what the health disparities are that exist out in the population. And then we'll also do an environmental scan of community assessments that have occurred in the last couple of years. So the Affordable Care Act, along with other statutory rules, have dictated that communities do community-specific assessments. So we'll really draw on those and information from those to help give us some baseline understanding of what's going on in your community. So if you look here, this is that first bucket of surveillance and administrative data. As you can see, we rely heavily on national and local surveys. So national surveys like the BRFSS, which is a survey of adult health, Oregon Healthy Teens Survey, School Health Profile Survey, Student Wellness Survey. Those are all surveys that really get at adolescents, both in terms of adolescent health outcomes, but also school health policy. The Pregnancy Risk Assessment Monitoring System, or PRAMS, Oregon SMILE Survey, and the National Survey of Children's Health, all really important for early childhood outcomes. Oregon Vital Statistics, so we can get death rates, those types of things, and mortality information, as well as birth outcomes, that sort of thing. We have a lot of encounter data, as well as U.S. Census data. So that kind of gives us a sense of social determinants of health, but also what are some clinical outcomes, as well as administrative data from our WIC program, our hospitals, and some consumer satisfaction surveys, both in terms of SBHCs and other clinics. Looking at that list, are there other health and social determinants health data sources that are missing from that list and are publicly available that you think are important for our needs assessment and that we should be looking at? If so, if you want to put that in the chat box, I'm happy to look at those, and we're happy to see what we can do to analyze those. It should be noted that we're trying to get to as many sources as possible, but we won't be able to analyze every single data point on every single data set. So I'll give you a second to think about that. The list is back up there. Yeah, that's a great point. Some social determinants data is being collected through Epic. So that will definitely be something that we can maybe look at with some of our systems with respect to encounter data. Okay, well, this isn't your last chance. There will be a couple more opportunities to inform what we look at with respect to quantitative data. So if we want to move on, we can look at other sources of information that we're going to be looking at. So these are concurrent assessments sources, and again, this is not an exhaustive list. This is just our first stab at putting something on a slide to really get at kind of a high-level overview. So as I said, CCOs, local public health authorities, or counties, and hospital systems all have to do community health assessments as a part of federal law. So that's included here. We have the state health assessment and state health improvement plan that our public health division, our state public health division, is working on. That will be a source of information. We have some grant required needs assessments that we will be looking at and scanning over. Children's First of Oregon has a great data collection tool that we'll be looking at. We'll be looking at specific population needs assessments. So you see needs assessments for Pacific Islanders and homeless residents, as well as needs assessments with respect to specific health issues. So sexual and reproductive health needs, needs of immigrant and refugee communities, as well as we have a couple of reports on schools and school safety, which is particularly important for school-age children 5 to 21. So, are there health assessments that are missing from our environmental scan? And we know there probably are. So please feel free to type those in the chat box. And just know that we have already collected a big chunk of all the CCO and county-wide state health assessment, health assessments. So we'll be looking at those. Okay, so one of the suggestions is that there are a lot of LEPs. Oh, okay, and interpreters helping them can be a source of neutral data. Just a suggestion. Yeah. So that might be part of our qualitative data analysis going forward, and some of the folks we should include in focus groups. Is there a tribal health MCH assessment available? I think that would be part of some of the needs assessments, larger needs assessments, that we would find that information, but I'm not actually positive if there is a specific tribal health, Maria. Yeah.
We can check, Joanne, this is Nurit Fischler. We can check also with the Northwest Portland Area Indian Health Board to see if they have anything that would cover that. That's a really good suggestion.
Yeah. And then we got a website, it looks like, for social determinants of health. We'll definitely look into that and see what we can draw from that. That's a good suggestion. Okay, an infant feeding survey for our women on the coast through Clatsop County. Okay, Multnomah County Health Department is currently undertaking a countywide project looking at Pacific Islander health. Oh, you do not use the 2015 report. That's good to know, and we will take that into account. Thank you for that. Our state staff going to look at local CHAWS for possible additional local data? Yes. So that would definitely be included in that. Yeah. So we'll definitely be scanning for that as well, especially as they relate to identifying needs in regionally or locally. Okay, it's a little quiet, but again, feel free to email us afterwards. We'll have contact information or follow up. Thank you.
Or you can also continue to type things in as we move through the webinar, and we'll capture them as we go.
Hi, so this is Maria Ness, and I'm going to be talking about the special populations of focus that we're going to be looking at in this needs assessment. And just to sort of go back to what Nurith was talking about the big picture of the pieces of the needs assessment, this is after we've looked at the health status data and the previously conducted community assessments that Wes just referenced. The piece that we're trying to really expand on this time in the needs assessment is getting more of the community voice included in this, in selecting our priorities. And so basically that looks like qualitative data collection, so things like focus groups, listening sessions. So we're really trying to get out there and hear from our communities what their needs are. And so to do this, though, we had to, obviously, we don't have, unlimited resources, so we had to think about which population specifically we should be focusing on. And so in order to do that, we used a couple of different selection criteria to select these communities. And one of these was, we looked at in our previous Title V needs assessment in 2015, and then also just generally in the data that we already have, where are the voices that are underrepresented or that we're not hearing from? So that was the first thing that we looked at. And then secondly, we looked at, in the data that we do have, so primarily looking at the health status data, so from things like surveys, where are the groups that we see consistently that there are disparities in maternal, child, and adolescent health outcomes. So using those two selection criteria, we've narrowed down a list of special populations of focus. And so, yeah. So on this slide, you'll see that this was actually done. So we conducted this exercise separately in the three sections that are collaborating for this needs assessment. So we did this in maternal and child health. The exercise was also conducted in adolescent health and also at Ocean for children and youth with special healthcare needs. So each one of the teams has come up with their special populations of focus. So you can see that for maternal and child health, we've selected African American and Black communities, Hispanic or Latinx communities, homeless families, immigrant and refugee communities, Native American or Alaska Native communities, and rural communities. And then for adolescent health, they selected LGBTQ+ youth, Native American youth, Spanish-speaking youth, and students with disabilities. And then for Ocean, they selected children and youth with special health care needs who are African American and or Black, children and youth with special health care needs who are Latinx, or children and youth with special health care needs who have behavioral or mental health conditions. And I just wanted to make a note that specifically within the maternal and child health special populations of focus, we're also, since we obviously weren't able to select all of the groups, and we had to prioritize these, that we're also going to be, while looking at those, taking note of the special needs of a couple of different groups. So non-traditional caregivers and non-traditional family structures. So for example, the needs of fathers and grandparents, or the needs of the LGBTQ+ families. So those are the groups that we selected. And So what we're hoping to get from you today is we want to know what your opinion is on the groups that were selected and if we are missing any important communities. So there are a couple of things to keep in mind while we're doing this. And one is that like I said, we have very limited resources available. So while we would love to be able to obviously address, exhaustively all the different communities across the state that either have disparities or that we haven't heard from before, we do have to try and, limit ourselves to what we're able to do with our capacity. And so whatever suggestions you make, we're definitely very open to thinking about this list and if there are missing communities. But if we do end up selecting any of the communities that you suggest, that might mean that we have to drop off some others that we have on our list. So that's just something to keep in mind. And the other pieces to keep in mind when you're making suggestions is that even though these are the populations that we're including in the qualitative community voices section of the needs assessment, this by no means is the only place that we're looking at health needs. So other communities who may not be listed here are still going to be included in the other parts of the needs assessment. So like what Wes was talking about with the health status data that we're looking at and the span of previously conducted assessments, populations who may not have been included here are going to absolutely be included in those other pieces. So this is really just for that focused, qualitative, things like focus groups and interviews, those sorts of things. So if you could, oh, sorry, there's a question. Okay, sorry, there's suggestions coming through. So we can go to the next slide, Stephanie. There's
They can't, you need to say, they can't see if you want to share with them.
She does. She wants to go to the next slide.
Yeah, I was just going to say, could we go to the next slide and then we'll. So this is the question that, oh, go back one. Sorry, there we go. Technical challenges over here, sorry. Okay, so this is the question that we're asking, is that are there any special populations of focus that you think we should be added, taking all of those different caveats that I just mentioned into account. So we have some suggestions up on the board already, on the chat box already. So we have teens in maternal and child health, and they will definitely be addressed by adolescent health. We're definitely going to cover that population. Thank you. Pacific Islander youth. We definitely know that that's a group that we that have disparities and that hasn't traditionally been heard from. The other piece that we've been talking about is that this needs assessment is only, we actually do conduct ongoing needs assessment activities throughout the 5 years of the grant cycle. So even though during this 1 year we're going to be doing a big focus on needs assessment, we are going to be continuing to do ongoing needs assessment activities in the following years. And so some of these populations that we haven't been able to focus on in this sort of big effort, we can definitely work on. And I think that that is going to be probably potentially where we're going to be able to put some resources into looking at Pacific Islander communities. And then foster parent population, absolutely. So this is another one that we talked about where we know that there are disparities and that it's traditionally we haven't heard that much from these communities, but again, that's probably going to have to fall into further ongoing years of needs assessment activities, just because we can't fit everyone into the first year.
Okay. Well,
Yep,
thanks,
thank
Maria.
you.
Yeah. So this is Allison Martin from the Oregon Center for Children and Youth with Special Health Needs, And the last piece that we wanted to talk with you all today about was community engagement. And so as we've been talking about, it's really important for us to obtain stakeholder input on our needs assessment approach. And that's what we're doing today, but there's also a couple of other ways that we're going to be engaging the community in our needs assessment.
So we will ask for partners from the community to work with us on the implementation of our needs assessments. And of course, as we've been talking about, participate in our data collections. But where we want to focus this last part of the discussion is on providing input on our approach. And so Stephanie, if you could please go to the next slide. So Maria just went through the special populations of focus that we will be working on during this 5-year needs assessment period of time. And what we would like to hear from you all are what community organizations anywhere in Oregon, not just in the metro area, should we be partnering with in order to engage these communities in our needs assessment. And if you could please share with us again in the chat box any suggestions that you have for organizations that would help connect us to these communities. And so Hannah, thank you. You suggested the living room. Youthline, thank you. That's the 9 Tribes of Oregon, great. ERCO, great. Black Parent Initiative in Portland, thank you very much. And then Katrina, you suggested SMYRC and SMRC. And so my colleagues are familiar with that acronym, so I won't ask for clarification about it. The Oregon Doula Association, great, thanks, Deborah. Okay, those are wonderful suggestions. They validate some ideas that we had, and then they also expand our suggestions as well, and that's wonderful. So, and then Eileen, you added United Territories of Pacific Islanders Alliance in Portland, great. And then Bruce, you also suggested FACT, yep. And Charlie, you said for, I think you were suggesting another population, subpopulation. The Oregon Latino Health Coalition and the Latino Community Association, and I think Morrison, Banjo, I think you're suggesting the Morrison Center, is that the, and Jessica, we see yours, ORCHWA or OR, ORCHWA?
Community Health Worker Association.
Cool, perfect. These are why we do these webinars, because you guys are rock stars. Mm-hmm. Another vote for FACT, and then also Peace.
Families of lesbian and gay.
Awesome. Okay. Good. The Early Learning Hubs. Yep. Thanks, Steph. Awesome. We'll keep those wonderful suggestions coming. And we'll jump to, we have another question for you. So you might recall from Nurit's earlier graphic that in addition to community voices, we also want to obtain input from partner and provider voices. And so on the slide right now, we've listed some of the organizations that we've worked with in the past and some we've brainstormed that we should add to obtain information from. In our 2015 needs assessment, how we went about obtaining partner and provider voice input was through a number of surveys, also online discussion forums, listening sessions at community partner meetings, webinars, and we would expect to use some or all of those methods for this current 5-year needs assessment. And then what we wanted to ask you, if that question was able to make it on the slide. Yeah, thank you, perfect. We just want to make sure that we got as broad a perspective as possible. So in addition to the organizations listed on that slide, are there others that we should invite to participate in one or more of our partner and provider voice data collections? And Thank you for going back to that slide. Staff conducting the Oregon Healthy Teen Survey, that's great. Nope, there's no particular order to the listing. The Oregon Perinatal Collaborative, that's great. Health Insight and ORPRIN, Oregon Maternal Data Center, Future Generations Collaborative, Planned Parenthood, these are great suggestions. Lutheran and Catholic Charities. Oregon Primary Care Association, yep, perfect. ODE for the regional programs for low incidence disability support. Great, thanks Bruce. Public health modernization groups. Thank you, that's a great suggestion. I think that was Danita. Portland Homeless Youth Continuum. Great, thank you Tiffany. And Tristan, you said other Head Start providers in addition to OCDC. Great. The Oregon Office of Rural Health, thanks, Steph, that's a great suggestion. Local WIC offices, thank you, Katrina. Baby Blues Connection and Postpartum Support International, thanks, Wendy. And Joanne, you suggested the Moore Institute for Nutrition and Wellness at OHSU, that's a great suggestion. Healthy Families, thanks, Jessica. The OHSU Unite Cancer Community Ambassadors, thanks, Danita. The Oregon Teen Pregnancy Task Force, good. You guys continue to be awesome rock stars. Everybody around the table here knows that if I have an opportunity to use the word rock star, I like to do that. So keep the suggestions coming. Since we hit a little bit of a lull there, I'll turn it back over to Nurit.
Okay, thanks. So, this is Nurit Fischler again. I'm just going to close out with one more question before I do this last slide, which is what haven't we thought of? You've seen kind of our plan, our overall plan, our populations of focus. We've had some conversation about communities, how to reach communities, and how to reach providers and partners. Are there things that we're not thinking of yet that we should be in terms of approaching this needs assessment over the coming year? I'm going to give you just a moment to type in if there's anything you can think of that we haven't kind of laid out in our overall plan. Or you can raise your hand in the, I think you can do that if you want, or type into the chat box. Let's see, Jessica says, I know you're talking about doing focus groups with community members. What about home visiting staff? That's a great idea. We will put that in the hopper. Thanks, Jessica. Any other things that folks have on their mind that they'd like us to be thinking about as we put this all together? It won't be your last opportunity to hear from us or to be involved. So continue to type in. Oh, Charlie says, will this assessment include training needs of local MCH staff? I think that's a really good idea, Charlie, and that can be part of our provider voices piece and part of our scan of what the MCH needs of the state, the system needs. I think that's where we really have to start to understand what it is folks need in relation to the priorities we choose. What about legislative mandates and early learning groups? From Deborah, thank you. That's a great thing for us to keep in mind. And it was Char's idea. Charlie, you got credit for it because you were the one logged in. Okay, that's great. Oh, and one more idea there about assess data sharing tools. I might need to find out more about what that means, Charlie, but we will follow up with you on that one. Thank you. All right, I'm not seeing a whole lot more pop up. So I'm going to go to this last slide, which is that we just want to encourage you to continue to be engaged. We're really excited. We had 100 people register for the webinar today. So it's a great launch, but that's really what this is a launching point. And there's going to be a lot of opportunities to continue to participate in planning, to take part in surveys and online discussions, listening sessions, all of those, to engage your own community to make sure that their voices are heard. So let us know if you want to host any activities or listening sessions in your community, and keep letting us know what we're missing, because we really depend on you all for that. And just a plug of why to get involved. This is really what guides the selection of the funding of our priorities for the next 5 years. We want to ensure that the needs of your community are heard from and understood as well as we possibly can in this process. So get involved now and stay involved with us. Let us know what you're thinking and how you want to be a part of the needs assessment over the coming year. Is there anything else that folks here in the room want to say before we sign off? No. Feel free to download the slides from today in the chat box or the file pod, whatever it's called in there. Thank you very much for spending some of your afternoon. Oh, and the contact information slide, I'm sorry. There's one more slide. There we go. Oh, and it's a slide with a picture of baby Pearl on it. How could I have missed that? All right, there's our follow-up contact information. In case you want to talk specifically about particular parts of the needs assessment, there's Maria West and Allison ready to talk to you. And if you want to talk about more general Title V questions or thoughts or issues, you can always get in contact with me or Kate Wilcox or Stephanie Glickman.
Who's baby Pearl?
Who is baby Pearl? That's my daughter.
Baby Pearl's a young adult.
Yes, baby Pearl is now 19, so we'd love to see the baby pictures. Thanks very much, everybody. Oh, that was who was baby Pearl from Mandy. Thanks, everyone, and have a great rest of your day.
Someone wants to know about certificate.
Sanjoy, certificate of attendance. Can we send that, Stephanie? We will make you one and send it. We can send we can send a certificate of attendance to anyone who needs one. Just send an email to Stephanie and let us know. And Sanjoy, we already have you on the list. Thank you.
Bye, everybody. Thank you.